You wake up. You rub your eyes. The room looks a little soft around the edges, a little blurry, a little tired. You tell yourself it's just the morning, just your age, just needing another cup of coffee before your eyes wake up too. I need you to hear this clearly. Sometimes that isn't tired eyes. Sometimes that is the opening scene of a permanent, irreversible loss of vision. And the window to stop it isn't weeks. It isn't days. In some cases, it's measured in hours. I'm Dr. David Thompson, and for years I've sat across from patients who described exactly what I just described to you. A little blur, a little haze, and told themselves it would pass. Some of them were right, but some of them were living through a silent ocular emergency, and by the time they called anyone, the damage was already permanent. Not difficult to treat, not manageable with therapy. Permanent. That's the cruelty of this. It doesn't announce itself with pain. There's no dramatic collapse. It whispers. And for an independent adult who values driving to see their grandkids, reading their own mail, recognizing a face across the room, a 48-hour delay in recognizing the right warning sign can be the difference between an eye doctor fixing the problem and a life sentence of permanent vision loss and lost independence. Today, I'm going to walk you through 3 specific warning signs, not vague ones, specific ordinary feeling sensations, a wavy door frame, a flash of light, a ring of color around a streetlight that your brain will try to explain away as nothing. I'm going to tell you exactly what each one means, exactly what the emergency clock looks like for each one, and exactly what to do the moment you notice it. If you take one thing from this video, let it be this. Your eyes are trying to talk to you. Today, you're going to learn how to listen. Before we go further, a quick and important note. I'm sharing general health education here. This video is not a substitute for an eye exam, and it isn't a diagnosis of your specific situation. If anything I described today sounds like what you're experiencing right now, please don't wait to finish this video before calling your eye doctor or an emergency room. Some of what I'm about to describe genuinely cannot wait. To understand why these 3 warning signs matter so much after 60, you have to understand what's actually happening inside an aging eye. Because the eye doesn't age like skin does. It ages like plumbing and wiring age, quietly, structurally, until one part finally gives. Start with the macula. This is the small patch at the center of your retina, responsible for your sharp, detailed vision. Reading a text message, recognizing a grandchild's face, seeing the numbers on a prescription bottle. The macula sits on top of a dense bed of tiny blood vessels. Over decades, those vessels can become fragile, brittle, prone to leaking. When they do, the macula doesn't erode gracefully. It can flood, almost overnight. Then there's the vitreous humor, the clear, gel-like substance that fills the back 2/3 of your eye and gives it its shape. In youth, this gel is thick and firmly attached to the retina, like wallpaper glued flush to a wall. With age, that gel naturally liquefies and shrinks, pulling away from the retina. Most of the time, this is harmless. It's called a posterior vitreous detachment, and it happens to nearly everyone eventually. But sometimes, as that gel pulls away, it doesn't let go cleanly. It tugs, and where it tugs, it can tear the retina itself, like old wallpaper ripping a chunk of drywall away with it. And finally, the optic nerve, the cable carrying every signal your eye captures back to your brain. This nerve is exquisitely sensitive to pressure. In a healthy eye, fluid drains out at the same rate it's produced. But the drainage angle inside the eye can narrow with age, and if it closes off completely, pressure can spike dramatically within hours, crushing optic nerve fibers that, once lost, do not regenerate. Macula, vitreous, optic nerve. 3 vulnerable structures, 3 different failure points, and 3 warning signs that map directly onto them. Let's go through each one. Margaret was 71 years old, and she loved her kitchen. One afternoon, she noticed something odd about her own doorframe. The vertical edge, the one she'd looked at 10,000 times, looked slightly bent, not dramatically, just off, like a slightly warped board. She blamed the house. She told her daughter the contractor who'd built the addition years ago must have done shoddy work, because look at that doorframe, it's crooked. Weeks passed. The waviness spread. The edge of her refrigerator, the lines on her placemat. It was never the house. It was wet, age-related macular degeneration, and those fragile blood vessels I described a moment ago had begun leaking fluid directly underneath her macula, physically distorting the straight lines her retina was trying to report to her brain. By the time Margaret finally saw a retina specialist, she had lost significant central vision in that eye permanently. Not because the condition was untreatable. Wet AMD caught early can often be stabilized with injectable therapies that seal off leaking vessels, but those therapies work on the vision you still have. They cannot resurrect vision that's already been destroyed by weeks of fluid damage. Here's how you check yourself for this at home, right now, and I want you to actually do this, not just listen to me describe it. Find any grid of straight lines, a piece of graph paper, a tiled bathroom wall, even the crossbars on a window screen. Cover one eye completely, look directly at the center of the grid, and ask yourself honestly, are any of these lines wavy, bent, or blurred? Then switch eyes and repeat. This simple test is a rough version of what's called an Amsler grid, and eye doctors use it for exactly this reason, because macular distortion often shows up in one eye long before the other, and your brain is remarkably good at quietly compensating for one weak eye using the other. That compensation is exactly what let Margaret miss it for weeks. If you see any waviness, any missing patch, any blur that follows you no matter which direction you look, that is not a home repair problem. That's an appointment you make today, not next month. If you've ever caught yourself blaming a crooked wall or door frame in your own home, type vitality in the comments right now, and I'll make sure you get the printable version of this grid test. Arthur was watching television one evening. Nothing unusual, just his regular chair, his regular show, when he saw what he described as lightning flashing at the edge of his vision. No storm outside, no lights flickering in the room, just his own eye, quietly producing flashes that weren't there. He went to bed thinking he was overtired. He woke up the next morning and part of his vision looked like it was behind a dark curtain pulled halfway across from the side. That curtain was a retinal detachment, and the flashes the night before were his retina being physically tugged and torn as the vitreous gel pulled away from it. Exactly the mechanism I described earlier, the wallpaper ripping the drywall. Here is the piece of this story that matters most. A retinal tear caught in that flash and floater stage before it progresses to a full detachment can often be sealed shut in an office visit with a laser, a same-day outpatient procedure with an extremely high success rate. But once the retina fully detaches and that curtain appears, you're now looking at emergency surgery, a much harder recovery, and a real chance that some portion of that vision never fully returns. The entire difference between quick laser fix and emergency surgery with permanent risk often comes down to acting within about 24 hours of the first symptoms. So here is what I need you to know cold, without having to think about it in the moment. New flashes of light, especially in dim rooms, especially if you've never had them before, combined with a sudden shower of new floaters, that cobweb or shower of spots appearance in your vision, is not something to sleep on and monitor tomorrow. That combination is one of the few genuine same-day ophthalmology emergencies. Not urgent care, not call in a few days. Same day, ideally within hours. To be clear, occasional single floaters that have been with you for years, drifting the same lazy way they always have, are common and typically harmless. That's the normal vitreous aging I mentioned earlier. What changes the calculation is suddenness, a new flash, a new shower of floaters, especially together, especially all at once. If you've ever noticed a flash of light out of nowhere and brushed it off, comment independence below. I want to know so I can put together a follow-up video on exactly what an emergency eye visit looks like, step by step. One of my patients, I'll call him Walter, because the details of this one deserve some privacy, came in describing what he thought was a sinus infection, a dull, deep headache behind one eye, some nausea, and when he drove home the night before, every streetlight had a strange rainbow-colored ring around it, like looking through a fogged windshield. He nearly went to bed with some allergy medication and a heating pad. What was actually happening was acute angle closure glaucoma. The drainage angle inside his eye had suddenly closed, and fluid that should have been draining out was trapping itself inside, spiking the pressure in his eye dramatically within a matter of hours. That optic nerve I described earlier, the cable carrying every signal to his brain, was being crushed in real time. The headache and nausea weren't sinus symptoms at all. They were his body's response to a spike in eye pressure severe enough to be genuinely dangerous. This is, without question, the most urgent of the 3 warning signs, because unlike the first 2, it can also come with real pain and can escalate to complete, permanent vision loss in that eye within as little as a day or two if the pressure isn't relieved. The rainbow halo happens because that spike in pressure causes the cornea to swell slightly, and a swollen cornea bends light the way a prism does, which is exactly why streetlights and headlights suddenly look like they're wearing rings. If you ever notice rainbow-colored halos around lights at night, paired with eye pain, brow bone headache, nausea, or blurred vision, even if you're only thinking maybe it's a migraine, that is an emergency room visit that night, not an appointment for next week. Acute angle closure glaucoma is treatable, often very effectively, with medication to lower pressure and a quick laser procedure to open the drainage angle permanently. But it is genuinely a race against the clock in a way most eye conditions are not. So let's bring this together into something you can actually use. 3 warning signs, 3 different structures failing, 3 different emergency clocks. Wavy lines or a warped door frame. Check yourself with a grid test regularly and treat any new distortion as a this week appointment. New flashes of light with a shower of floaters. Treat that as a same-day emergency, ideally within hours. Rainbow halos around lights at night, especially with pain or nausea. Treat that as tonight at the emergency room. Beyond watching for these 3 signs, the single best protection you have is a dilated eye exam. Not just a vision screening, an actual dilated exam where your doctor looks directly at your retina and optic nerve. After 60, most eye doctors recommend this annually, or more often if you have diabetes, high blood pressure, or a family history of glaucoma or macular degeneration. That exam catches changes long before you'd ever notice a symptom at all. I want to say clearly, one more time, I'm not your doctor, and nothing in this video replaces an actual eye exam or emergency evaluation. This is general education, not a diagnosis of what's happening in your eyes specifically. If anything I described today sounds familiar, please don't wait. Call your eye doctor, or if it's after hours and symptoms are severe, go to the emergency room. Your independence, driving yourself to see the people you love, reading your own mail, recognizing a face across a room, is worth protecting fiercely. If this video helped you understand your own eyes a little better, share it with someone in your life who needs to hear it too, and subscribe so you don't miss the next one. I'm Dr. David Thompson. I'll see you in the next video.